Good morning. I know we can do better than that, and we have to. Good morning.
Good morning.
Great. My name is Dave Schmittlein, and I'm Dean of MIT's Sloan School of Management, and I'm very happy and proud to welcome you to this conference about digital transformation in health systems. I'm very grateful to you as students and alumni and faculty and friends of MIT for gathering around this important set of topics. I'm especially grateful to the speakers and panelists who have chosen to spend their time with us, with you here today. I'm very grateful to the staff who design and deliver events like this. I, in particular, would like to call out Anna Quadgras and Ken Kaplan and Retzef Levy for their role in designing collaboratively this event. It is a great set of sessions today, and I know that it'll be both important and stimulating and interesting for all of you. I hope you may think of MIT and its Sloan School of Management as a place where complex systems in dynamic environments are being changed by smart and inventive people. And I know that most or perhaps all of you see health systems in the United States, health systems around the world in exactly that way. I hope that you also see a great set of opportunities in digital transformation at this time, because there is both a timelessness to the relevance of MIT for these systems, but also a timeliness. You know, you can talk about artificial intelligence, if you like, and machine learning as one part of that timeliness of today, as providing a particular impetus for the work at MIT and its Sloan School in this area. In fact, one of the topics that you'll hear about this afternoon relates to a new initiative, a new lab at MIT, the IBM MIT Watson Artificial Intelligence Lab, that will be bringing machine learning, artificial intelligence approaches to themes like medical imaging, exciting new ways to use electronic medical records, and personalized and customized medicine, just to take some initial examples. So I trust that this will be a great meeting for you, an opportunity for you to both learn but also to participate. I would ask you, please, to make this experience, gathering around these themes, cause something to be different for you and in the world. Let us know what your reactions are to the ideas here. Our work at MIT in health systems is itself dynamic. It's changing as a reflection of where the interests are of people like you and where the support for new kinds of activities and innovative events arise. So use your voice to tell us what you'd like to see us doing. Use your voice in another way. Tell people who aren't here today something about what happened that you found interesting. Talk about MIT, talk about the Sloan School, talk about innovation in healthcare. Third, I would ask you, please, do something different in your own life based on what you experience here today. This ought to be not just interesting information, and then you go about the rest of your life as if nothing was different. Take some action, try something new based on some idea or some interaction that you had here today. Finally, before I introduce our conference moderator, as Dean of the MIT Sloan School, you know I'm going to ask you to support the school, and I am. One of the ways I want you to support the school is by using your voice. Please tell people about good things that are happening at MIT. Not enough people know. The other way that I will ask you to support the school is philanthropically. This activity in innovation in healthcare and the convening around this activity is only possible because people care, because people support us. I would ask you in the context of MIT's campaign to think about how you could support this kind of activity at MIT. Now I'm delighted to introduce our conference moderator for today, Jay Levine. Jay formerly was Executive Vice President for ECG Management Consultants. As I think you all know, ECG is a widely known national healthcare consulting firm, and Jay's experience is, I think he's a young man, but somehow he has over 30 years of experience advising academic medical systems and beyond with respect to healthcare issues. Just a few of the organizations that have sought his advice include Mass General and Mount Sinai, Columbia University College of Physicians and Surgeons, Stanford University's Medical School, Johns Hopkins School of Medicine, and other places as well, including the National Academy of Science and the NIH. So you are in extremely good hands today. Would you please, as I need to run to the airport, would you please welcome Jay Levine?
Thank you, David. I was told when I agreed to serve as the moderator that I really needed no introduction, but that was a nice, warm introduction. In addition to my career as a management consultant to academic medical centers, I am happily retired at this point. I serve on the advisory board for the Sloan Initiative for Health Systems Innovation. I'm also involved with other healthcare activities, serving on the board of a local community hospital, and have been involved with activities at a university hospital near where I live, having to do with the acquisition of community hospitals, all on a pro bono basis. I'd like to take a few minutes and create a context for today's conversations. As the dean mentioned, I've been involved in healthcare for my entire career, over 30 years. In my view, there's more uncertainty and upheaval in the healthcare industry today than at any time since the enactment of Medicare and Medicaid in 1965. I'm just going to give you 4 quick examples of this upheaval without delving into them too much, because they're going to be very apparent to you. First of all, we have overwhelming political turbulence. For example, just a few weeks ago, the voting population in Maine endorsed the expansion of Medicaid in that state over the opposition of the governor of Maine. On Capitol Hill, we have a federal tax plan that contains language that would totally upend the individual mandate for insurance. When we see a tax plan upending the health insurance industry, we need to assume that there's substantial upheaval, at least politically. We have huge and unsustainable operating losses in major health delivery systems in the United States. Just recently, Forbes magazine published the fact that the combined operating loss for Partners in Boston and MD Anderson in Houston exceeds $374 million in 2016. Further, I just learned last night over dinner that I don't live in Massachusetts, but I just learned that in Massachusetts, the state operating budget has 40% of the budget devoted to support of the Medicaid program in Massachusetts. Clearly, these expenses and these operating losses are not sustainable by our society. Third, we have emerging innovation in the style and the practice of delivering healthcare services, often employing digital innovation. We're going to hear today from the Director of Mental and Behavioral Health Services at Kaiser Permanente, who's going to talk to us about how digital technology is being used to expand the reach of behavioral health clinicians. We also see emerging models in healthcare delivery that are integrating behavioral health with primary care. And these innovative models are being designed, hopefully, to address the first two challenges that I articulated, the political uncertainty and the huge operating losses. And fourth, we're seeing an explosion in digital innovation in healthcare to the extent that some hospitals are augmenting their strategic planning activities to develop a digital strategic plan to interface with the other components of their strategic plan. And I think these four examples demonstrate the upheaval in the industry as well as the tendency to embrace digital transformation as at least one mechanism that could help to offset some of the financial and societal challenges that we confront. We have a very rich and exciting program today. We have on the agenda individuals who are on the faculty at MIT Sloan, including my friend and colleague Retzef Levy and Anna Quadras. We have participants who are notable alumni, including Dimitris Bertsimis, Aaron Broshi, Elliot Cohen, Paul Osterman, and Dr. Christine Silvers. We have industry leaders, including Liz Boehm, Thomas Grape, Dusty Mahundra, Don Mordecai, Carol Raphael, and Dr. George Velmos. And we have leaders from the public sector, including Jason Helgerson, Daniel Tsai, and Undersecretary Michael Wilkening. We're going to have the opportunity to ask questions of these individuals periodically through the course of today. And there will be individuals at the top end of each of the aisles with microphones in padded boxes that they are actually going to toss to you as you raise your hand. Please consider your own eye-hand coordination skills when you raise your hand. We don't want to hear boxes dropping down the stairs here. I'd like to introduce to you my friend and colleague Retzef Levy, who's going to kick off the conference today. Retzef is the Spencer Standish Professor of Management and Professor of Operations Research at MIT Sloan School of Management. In addition, he's the co-director and leader of the Global Operations Program at MIT. He's also the faculty co-director of the Initiative for Health Systems Innovation, which is the enterprise that is organizing and sponsoring today's conference. His current research focuses on the design and performance analysis of efficient algorithms for fundamental stochastic and deterministic optimization models that arise in the context of supply chain, revenue management, logistics, and healthcare. I tried to memorize this paragraph last night, but I failed, so I need to read it. He also has special interest in cost balancing techniques, data-driven sampling-based algorithms, modern linear programming-based approximation techniques. In addition, he's interested in stochastic optimization and mathematical programming in their broad definitions, especially in their intersections with problems that arise in the context of real-life experiences. He has an interesting presentation. I saw a piece of it last night. Please welcome Retzef Levy to the podium.